This morning, we're diving into some of the signs of hearing loss as we welcome in Candace Fischer, owner of Fischer Hearing here in Regina. Thank you so much for joining us this morning, Candace.
Thanks for having me.
So tell me a little bit about, how you know if you or maybe your loved one is experiencing hearing loss.
Yeah, great question. There's lots of little subtle signs. Hearing loss is hard because we can't see it, so we call it the invisible handicap. And with hearing loss, because we can't see it, often it gets ignored, it goes untreated. So there's a few signs to watch for with your friends and your family that if you start to notice, you might want to get them in. Difficulty hearing women's voices, children's voices can be hard. Asking for frequent repetition is a big one. Ringing in the ears, we call that tinnitus. That can be a sign of hearing loss as well. Difficulty hearing on the telephone, difficulty hearing in background noise or competing noise. All of these are signs that there could be difficulty with the hearing.
For sure. And, what other kind of signs or maybe behaviors should you look for a shift in?
Yeah, great question. With hearing, it's very hard to have to actively or work to hear. The brain really struggles when we overload it. We have what we call cognitive load. So the brain can only really do so much at a time. When we're struggling to hear, if you think of hearing sound, if we drop that mug on the table, it's really loud, that's easy. Speech is really hard. It's a very complex signal. So somebody that's really struggling, really working to hear, they're often exhausted. They're not remembering things like they once did. So we really want to make sure we're not putting them in that position.
Absolutely. And so they're, experience that fatigue, that overwhelmed feeling. What other kind of behaviors do they typically see that shift in as well? Yeah,
that's great. For the fatigue, for sure. And even things, if you think of, you maybe go to pick up your parent or your grandparent and they say, oh, what are you doing here? They've forgotten that you were coming. So when we have to work really, really hard to hear, we're often forgetting things as well. We just don't have room in that memory bank or in that brain to be able to remember things. So you'll find people forgetting things. You'll find people starting to isolate. We try to avoid what's hard for us. I think we're all the same in that. And if it's really hard for me to focus when there's 4 or 5 of us for coffee, I might just start staying in my room by myself. I might quit meetings because it's hard to hear. I don't hear. I'm not going to go to that meeting anymore. I can't hear them. People will often say, I hear what I want to hear. Of course, my response to that is, well, if you didn't hear it, you don't know that you missed it. So we really want to bring in as much as we possibly can.
Absolutely. And for those of us who are either seeing those signs in ourselves or maybe others, what can we do about it?
Get your hearing tested. The simplest thing. We really try hard to make it a fun hour. It doesn't have to be a horrible test. It can be a lot of fun to have your hearing tested. It's great information, all part of your health history. And hearing care is health care. So absolutely no reason at all not to get your hearing tested.
Amazing, Candace. And where can people get in touch with you?
We are located, Fischer Hearing is in the Osler Medical Center. And probably the easiest way is to give us a phone call, 306-533-1232.
Incredible. Candace, thank you for being here this morning and sharing some of this insight with us.
Thanks, Janelle, for having me.
Our pleasure.